If you have a senior dog, you've probably wondered about it. You see a subtle change. Maybe they seem a little lost, or they don't greet you at the door quite like they used to. And you ask yourself, is this just a normal part of them getting older, or could it be something more? Today, we're going to dive deep into what's really happening inside the minds of our aging best friends to understand a condition that so many owners face but very few actually have a name for. And that's really where it all begins, right? With that one question. For so many of us, the little shifts in our senior dog's behavior can be confusing and honestly, a little heartbreaking. It's so easy to just write them off as an inevitable part of aging, but that might not be the whole story. So this is the crucial question every single owner of an older dog eventually asks themselves. The line between what's normal aging and what might be a medical condition can feel incredibly blurry. So how do you know? How do you know when those little quirks and new habits are actually a sign that you need to pay closer attention?
Okay, take a look at these signs. They're so common, and yet they often get overlooked or just dismissed as, oh, he's just getting quirky in his old age. But let's look closer. Staring blankly at a wall, getting physically stuck behind a chair and not knowing how to back out, pacing around restlessly when the house is quiet at night, or a dog who's been perfectly house-trained for years suddenly having accidents. You know, these aren't just random behaviors. These are specific flags that can point towards a progressive underlying condition.
So if it's not just getting old, then what in the world is it? Well, veterinarians and scientists have a name for this collection of symptoms. It's a condition that is all too real for millions of aging dogs and the families who love them. So let's actually put a name to what you might be seeing at home.
The clinical term is Canine Cognitive Dysfunction Syndrome, or CCDS for short, and the definition itself gives us some really important clues. See those keywords? Progressive, that means it worsens over time, and neurodegenerative, which means it involves the gradual breakdown of the brain and nervous system. And here's a crucial part. It's a diagnosis that's only made after other potential medical causes for these behaviors have been totally ruled out.
And this is why we really need to take this seriously. CCDS is, for all intents and purposes, the canine version of Alzheimer's disease in humans. And I'm not just saying that casually. The parallels are absolutely astounding. They're both progressive cognitive disorders. But what's really wild is that on a microscopic level, the changes in the brain, things like the buildup of something called amyloid plaques and cortical atrophy, which is literally a shrinking of the brain, are strikingly similar. It's so similar, in fact, that dogs with CCDS are now seen as a powerful natural model for understanding and studying human Alzheimer's. Now get ready for this number because it's pretty shocking. Even though CCDs affects a huge number of older dogs, some studies say up to 68% of dogs over 15, fewer than 2% are ever formally diagnosed by a vet. Just think about that. That is a massive, massive diagnostic gap. It just goes to show how many of us are chalking up these serious medical signs to normal aging. And it's exactly why understanding this is so incredibly important.
So how can you spot the signs in your own dog? Well, veterinarians have come up with a super handy acronym to help us remember what to look for. DISHA. It breaks down the key behavioral categories. So D is for disorientation, getting lost in your own house or yard. I is for interactions. Maybe your dog is suddenly withdrawn or the opposite, super clingy. S is for sleep-wake cycles. You know, they're up all night and they sleep all day. H is for house soiling. A is for activity changes. Either they're totally apathetic or they're pacing around relentlessly. And that final A is for anxiety, new fears or a sudden spike in separation anxiety. This isn't just a checklist. It's a real framework to help you observe your dog's behavior more objectively.
Okay, so let's say you've noticed some of these disheartening signs. What's next? Well, the path to getting some clarity starts with a visit to your vet. And the whole diagnostic process is basically a careful investigation. The first thing you need to understand is that it's what we call a diagnosis of exclusion. This is so important. A lot of other common problems in senior dogs like arthritis pain, losing their vision or hearing, or even metabolic diseases can cause behaviors that look just like CCDS. So a vet's first job is to play detective and rule all of those other possibilities out one by one to make sure they're treating the right problem.
And here's what that process usually looks like. It all starts with you, the owner, giving a really detailed history of what you've been seeing. Then the vet will do a thorough physical and neurological exam. Lab work, like blood tests, is absolutely crucial for checking on organ function. And then your vet turns to you as a vital partner in this. They might use special questionnaires, validated ones like the CADIS or CCDR scales, to objectively score the specific behaviors you're seeing at home. And in some cases, they might even suggest an MRI to look for that telltale brain shrinkage we talked about.
And the science here is moving incredibly fast. Researchers are working hard to develop simple blood tests that can make diagnosis way easier and more objective. One of the most promising ones is a biomarker called neurofilament light chain, or NFL. Basically, when there's damage to nerve cells in the brain, NFL levels in the blood go up. It's looking like a really promising tool for identifying dogs with CCDS much, much earlier than we can right now.
Now, getting a diagnosis like this can feel really overwhelming. But here is the most important message I want you to hear today. There is hope. A diagnosis is not an endpoint. It is the starting point for a management plan. And while there's no cure, we can actively manage the condition to slow it down and, most importantly, improve our dog's quality of life. The absolute best approach is what vets call multimodal, which is just a fancy way of saying it combines a few different strategies at once. It really focuses on three main pillars. First, there's the pharmacological approach, which includes an FDA-approved drug called selegiline that helps correct chemical imbalances in the brain. Second is nutritional. This is fascinating. As the brain ages, it struggles to use its main fuel, glucose. But certain diets with medium-chain triglycerides, or MCTs, like from coconut oil, provide an alternative fuel source for the brain. It's like a backup generator for their brain cells. And third, environmental. Keeping their brain active with things like puzzle toys and new walking routes helps promote what's called neuroplasticity, the brain's amazing ability to form new connections. Ultimately, the goal of all of this, the whole point of management, isn't to turn back the clock. It's to improve and maintain the best possible quality of life for our senior companions. And the great news is, there are proactive steps that every single owner can take that make a huge, huge difference. Okay, just take a second to look at this slide, because the data here is incredibly powerful. A massive study called the Dog Aging Project found that, all other things being equal, inactive dogs were over 6 times more likely to be diagnosed with CCDs than very active dogs. 6 times more likely. This strongly suggests that physical activity isn't just good for their body, it is profoundly protective for their brain. It's one of the biggest modifiable risk factors we know of. So, let's bring all this together. What are the crucial points to take away from all this? First, and most importantly, those changes you're seeing are not just your dog getting old. They can be clinical signs of a real medical condition. Second, early detection is everything. The sooner you can start a management plan, the more effective it's going to be. Third, the best plan is a multimodal one that tackles the problem from every angle: medical, nutritional, and environmental. And finally, and this is maybe the most important part, you are the most critical member of your dog's care team. Your observations are what kickstart this whole process. So we end right where we began, but now we have knowledge and we have a plan. The changes that come with age can feel a little scary, but by understanding what's really happening in our dogs' minds, we can move from a place of worry to a place of action. By recognizing the signs early, by partnering with our vets, and by making proactive changes, we can truly answer this question. We can help our best friends navigate their golden years with all the dignity, comfort, and grace they absolutely deserve.